1995, my mother was hospitalized due to a staph infection and its effects on her body. Because of her insurance, she was transferred to a long-term acute care facility where her doctor said she should stay until she recovered. After 30 days, the insurance stopped paying for the care facility, and she was transferred to a nursing home that was not equipped to take her in. She was hospitalized again and soon fell into a coma from a urinary tract infection from the catheter she had to use. If her insurance would have paid for her to stay in the long-term care facility, she might still be with us today. And this is the kind of story that I care about, and I hope other people will be thinking about that.
My name is Jen. I was a staffer for Obama last year. Can't hear you. Sorry, I was a staffer for Obama in like 8 states last year, and one of the big reasons why I was healthcare. My dad has had tumors off and on my entire life, but they were always benign, and he always did a great job that was letting me take time off. Well, recently, after the election, my dad actually had a tumor that was cancerous, and he has since lost his job. Now, in the last, I was really proud to tell him, hey, Dad, like, look, like, he's a lifelong Republican. I got him to vote for Obama. Like, look, Cobra is less expensive now because of, what the guy I worked for did. And I was really proud of that. But, one of the weird things that I don't understand at all, and I still don't understand it, is that, he recently, he lost his job because he can't work anymore. He's in chemo twice a week now. And his job, is letting him go, and Cobra tells him he has to be unemployed for a certain amount of time. So he has to stop treatment. He stopped last week. And, we don't know what's going to happen now, and it doesn't make any sense at all. And, I'm really disappointed in this situation. So let's really get this taken care of.
Okay, my name is Herman Beavis. I'm a kidney transplant recipient. I have basically attended all schools here in Florida. I graduated with a bachelor's degree from Florida State University. As soon as I got out of Florida State University, I started working for Uncle Sam, collecting the taxes for the Internal Revenue Service. And I did such a good job that I noticed that perhaps I was in the wrong line of work and I needed to become a school teacher. So I went and became a school teacher for 14 years at a Native American tribe in North Carolina. Well, I lost the function of both of my kidneys, and I ended up being put on a hemodialysis machine for 5 years. And I came here to Jacksonville really to be with family and to go out to my happy hunting ground. Well, fortunately, Jacksonville is very good. It's a very good health area, and I got a kidney transplant. Well, after I got my kidney transplant, the social worker said I got good news and I got bad news. The Medicare that you have will only help you so much. You've got to apply for a program called the Medically Needy Program in Medicaid. I had lost my health care because I worked at an Indian tribe where where a Native American did go to their Indian health care. So for me, I was a contract employee. I had done everything right. I graduated from school, even got a North Carolina teacher's certificate. It was called a lateral entry. I had to go back to the university to get that. Now, for me, when I came to the point of 2006 here in Jacksonville, the medically needy program ran into a very serious issue. When prescriptions were being issued under Medicare Part D, it became virtually impossible. I'm talking impossible to access Medicaid. So what I done was, I went ahead and took them to court. I went into court, I won under the Department of Children and Family Services, which determines eligibility.